Well, the foundation was born from a simple question. How can we bring love back into medicine? To unlearn the so-called professional behavior and to learn that actually it is more professional to show up as a full human being. Welcome back to the heart of healthcare. It's been a while, and that time away was intentional. We've spent the past few years turning ideas into action, building programs, research, and real places of healing through the Heart-Based Medicine Foundation and the Heart-Based Centers.
Now, as we reconnect here, we're reflecting on that journey, where we began, what we've learned, and how this movement has grown. These 4 conversations close this chapter and open the door to what comes next.
We'll look back at how it all started, the journey. Then we'll explore how the principles in action came to life in daily care. Next, how Heart-Based Insights turned into programs and impact. And finally, what's ahead, the future and our invitation.
Thank you for being part of this story, for every listen, every reflection, and every moment of care you've shared.
Together, we're evolving healthcare into medicine with heart.
We begin with a voice from the past. Jan's opening words at the 2019 San Francisco Summit, a worldwide gathering of healthcare professionals with a keynote by Dr. Patch Adams.
We don't need to learn to love. What we have learned is to not love. And the medical system is not only not seeing this, but actually propagating it.
6 years later, what do these words mean today, and how did they set the foundation for what followed? Joining us is Melanie Frome, who became part of the foundation team in 2021 and helped shape the bridge from vision to practice. So Jan, here we are 6 years later. What were the personal and professional experiences that led to you founding the foundation in the beginning?
Well, the foundation was born from a simple question. Mm-hmm. How can we bring love back into medicine?
Good question.
You were there when we started, right?
I was indeed.
So it was a big question initially, right? How can we actually word it? Do we give ourselves permission to talk about this? Right? Can a white male talk about love, and particularly when it comes to pediatrics and healthcare, right? Mm-hmm. It seemed like a mining field.
Yeah.
But for me, it was obvious. It was like an obvious calling. I worked in public health, and being involved in very meaningful global public health programs, it became clear to me that we're missing something. And that's something I couldn't quite pinpoint for a while. But then as I stayed at the bedside throughout this public health work, I looked into babies' eyes and I saw mummies and babies. And I saw what is happening there.
The invisible field.
It was so obvious, right? And I knew this throughout my career. This is why I went into medicine in the first place. Right? It was about caring for people. It was about doing something meaningful. It was about seeing people getting better. It was creating an enabling environment. It was about contributing to a healthy next generation. That is what made sense to me. Mm-hmm. And so now the question was, what do you do when you see that it's obvious that love is a healing force, and it's obvious for everybody? Mm-hmm. And then, professionally, we are not allowed to have any emotions and get involved, because that introduces bias and confounding, right?
Not at all scientific.
No. And as a scientist, we actually have a respect for something that is as complex as love, and it's something that we can't measure. Mm-hmm. So there's a respect and a shyness around that, right? Mm-hmm. And then culturally, we may have hesitations, we may have shame, we may have, all sorts of ideas that love is an emotion, or it's limited to human beings, or it's something transactional and reactive and
romantic concept, and yeah. Mm-hmm.
None of this is true as far as I'm concerned. But this is what we try to unpack, right? And so it took a while until we actually allowed ourselves to go down that route and become very authentic and still and human and that was a really exciting moment when that happened, when we realized it is possible, it is important, everybody recognizes it, but we have, blocks and hesitations and all sorts of things that are in the way. Mm-hmm. And that was the moment where we realized that love is not something we need to learn, but we have learned behaviors of not love. Mm. And if that is something learned, and if love is what we truly are, then there is a way to return. Mm-hmm. And this is what I still see in every baby, thousands and thousands of babies, right? There's no question. Mm-hmm. When you actually look, there's no question that we need to learn love. Mm. It is understandable when we go through people's and individuals' biographies, it is understandable that we learn to not love. Yep. There's pain, we get hurt, there's maybe trauma, there are the experiences that are not loving. Mm. And so we learn behaviors of, non-loving behaviors. It's like a little virus that spreads, right? It's way more important than any of the pandemics. It's the non-love virus that we're spreading. Right? And so maybe as an infectious disease person, I thought maybe there's a way to treat not love.
As a virus.
And maybe there's a way to understand the transmission models of not love. And maybe there's a way to actually make this, become aware of where I am not loving as a person and where I might even think that I'm loving, but I'm not. And how can we actually, be less arrogant as healthcare professionals and become very humble and learn about love and health and learn about self-healing capacity through reconnecting to that ability.
That original field. I love it. Yeah. So that was the beginning of the foundation. That was 2018, right? What was the purpose and what was the vision at that time?
It was really accepting love as a guiding principle, both in care, in healthcare, as well as in science. So in healthcare, it meant to actually learn to unlearn the so-called professional behavior and to learn that actually it is more professional to show up as a full human being and to listen with every cell of my body rather than to just listen in a manipulative way so that that whatever you say meets my needs of making a differential diagnosis and following some treatment algorithm.
Ticking some boxes.
Boxes, right? Mm-hmm. So is that a possibility, right? That is the exploration on the healthcare side. And on the scientific side, it is the methodological challenge to take subjective experience as a gold standard. Mm-hmm. And that is something we're not used to in science. We're used to sort of objective external validation through machines that go beep. Mm-hmm. But with love, that's a little tricky. So we were looking at the field of pain quite a bit. And that's where actually a lot of this learning has happened as a model for us. Mm-hmm. So when a patient says, I have pain, in today's science, that's what it is. The patient has pain, and it can be quantified and described, but that's what it is, right? So the subjective experience is the gold standard. And if we can't measure it, then that's our problem, right? Then we have a problem and not the patient is invalidated. And it's just like 15, 20 years ago, probably, that in clinics, for me, if a patient said they're in pain and I saw on the monitor that their heart rate wasn't up and their blood pressure wasn't going up or their, skin conductivity or they didn't sweat or any of that, they didn't look pale, and I would go like, nah, don't buy it, right? So because I didn't have the ability and the capacity to measure, and that was my realm of truth, I invalidated the statement of the patient and said, yeah, some psychosomatic stuff, go see the shrink sort of thing, right? That's what I was thinking, right? And I wasn't alone with that, right?
So recent.
It's not, right? So now this has changed, right? And I think we have to go about love, the research into this field in a similar way.
Great. Okay. So I remember way back when, some of those early collaborations when the foundation was in its early years. We had the 2019 summit, some podcasts, and we had an advisory council and various guest bloggers. Can you tell me more about those early collaborations and how they came to be?
Yes, in the early days, it was about collaboration and voices coming together. It was about exploring before true partnerships formed. Mm-hmm. Mm-hmm. It was exciting. I was still traveling quite a bit at the time, mm-hmm. and whatever continent I got to, and I actually mentioned this to my colleagues, everybody was like, "Oh, really? Oh, is this what you're looking at? Really? Tell me more." Okay. Right? Or, "Oh, is there anybody else in my environment? I feel really alone with this. Like, is there anybody in my city? Did you meet anybody else? Can I talk to somebody? Can you build a network? Can we get to know each other?" So I feel alone. I'm working at this university somewhere, and I feel like I'm the only one who has these feelings, and nobody else talks about this.
Speaking a completely different language, yeah.
Right. Mm-hmm. And so then when I talk to a lot of my colleagues, other professors, and said, like, what do you actually, what is it for you? How much do you think, how much of what you've learned in medical school or in the congresses and papers and scientific encounters and all of that, how much of what you've learned is important in the healing process with the clients you see, and how much is about you and how you show up? And pretty much everybody independently said it's about 50%, if not more. That was quite quite astonishing. Yeah. So I said, great, we're doing a podcast. Would you be willing to hop on the podcast? I said, oh, no. So this is very sort of symptomatic of the early days. It's formation, it's finding partnerships, it's finding those who dare, it's finding pioneers in the field. And there were great people mm-hmm. who worked in the field of compassion and empathy, and we talked to them and had conversations, and then some of them joined our podcasts, and it was fantastic.
Truly daring to care. This is the title of your book, if I remember.
That was the time when that came up. Yeah, that came in very early. Right? So the wish to share, and actually part of it was the exploration in when I look back on the 20 years of what I've experienced in healthcare, what are the things that I've learned that I didn't learn in medical school, and that I would really like to see the next generation to know before they go into real life. And so that was what the book was about. Mm-hmm. Yeah, letters to my goddaughter, who was a young physician at the time, and she went into pediatrics, and so the writing style of the book was letters to my daughter. Yeah,
beautiful.
Very cool.
Yeah,
a beautiful book. Very excellent collaboration with Arjuna, my coach at the time, who has helped me to actually dare to go down that route, mm-hmm. and who has helped me then to kind of create a landscape of what were the experiences that he had, and help me move into the field more and to dare more. So that was a foundational partnership with Arjuna. Mm-hmm. Mm-hmm.
Mm-hmm. Yeah, and hopefully it will inspire many more medical students to take up that baton.
Yeah, I mean, this was the time when we worked together, right? I mean, you were there from pretty much the first hours,
sure.
Right?
Yeah.
And we were really struggling with how do you describe something that is very clear, but we don't really have the words for it, right? The English language has like one word, love. It's like, yeah, how do you make that happen, right?
Yeah.
How do you talk about the taste of a pineapple if you don't put it in your mouth? Right?
Yes.
How do you describe that? So yeah, your writing has helped a lot, and then we ended up a little bit in the esoteric
realm,
language realm, and then we said like, oh no, this is too far out there, so let's go back and be more sort of scientific, and then we ended up more in too much in the scientific side of things. So it's finding a balance, and I guess we're still sort of struggling with that, and that is true for many others in the field who are still trying to find words to express the importance of it and to convey how elementary and vital this is for healthcare.
Yeah, it's like you said, it's the elephant in the room. It's been the elephant in the room for so long. We're creating a new language and a new environment. So Melanie, you joined us in 2021 when the foundation was in its infancy. It was starting to take shape. I'm curious, what did you walk into? What did you find? How much of this original vision was being practiced, and how much room was there for growth, would you say?
Well, I walked into heart-based medicine, I think, during a unique, pivotal gestational period. I came in towards the tail end of when the thought leadership was starting to prepare for something more tangible. So it was already a movement or an organism that was filled with purpose, which was what drew me in. I was so excited to be part of this. But it had already evolved a little bit from the original vision because, thanks to COVID, some of the programs and projects that the foundation had put out there. So there was already a little bit of movement from the original. So I really arrived just as that transition stage started, and we weren't really sure what would cause the next leap of evolution. But all of these were factors that really made it such an exciting time to be part of the foundation. Mm-hmm. So the room to grow really was the heart of the vision. The heart of what Jan wanted to bring into this world was already beating. And I saw that my role could perhaps act as like building the circulatory system to make sure that the vision and that same sense of care that I experienced being part of the foundation could travel beyond with some structure and some flow, and essentially transforming the why into the how.
Great. And how did you find the rest of the team? Because there was a team when you came in. Were the values being embodied? Were they being lived, would you say?
We were an international team. We had people in the US. I'm in Scotland with a German background. It was beautiful to see a remote and in-person team collaborate in a way that was so aligned with the vision. The way everybody showed up for the team meetings, the way we set intentions, we implemented heart pauses that just made my heart happy to participate in. The idea that while our team outside of Jan, we're not medical professionals, we were the operations team behind the scene. We could experience and live some of the values that were being nudged towards the healthcare professional was really fascinating, because it made us realize love is universal. No matter what it's called, no matter how many names it has, it's universal. So to be part of the behind the operations scene team to help nudge that forward felt really powerful.
Great. Thank you. Thank you for showing up at that time.
Thanks for inviting me.
Okay, so Jan, back to you. How did those formative years take shape, and how did we build from 2018 to now, really, or to at least until the end of 2024? How did that set the foundation for what we have now?
Well, in many ways. So in 2018-19, it was the exploratory phase. Mm-hmm. A lot about collaborations, conversations, summit, podcasts, taking thought leadership. And then, or building thought leadership, rather. Then in the next 2 years, it was all about moving from concept to implementation. Mm-hmm. So it was actually quite reactive then, because we had two major events, right? Mm-hmm. First, we had COVID, and then we had the war in Ukraine. Right? Yeah. And during COVID, healthcare professionals were really struggling. Yeah. Right? They were at the end of their tether. It was really demanding, a global crisis. And many healthcare professionals actually had doubts about their own values, right? Mm-hmm. There was talk about moral injury. There was talk about over-care, over-commitment. There was talk about burnout. Yeah. I mean, there was a time where healthcare professionals just, left in droves, right? Because they felt that it's too much. We're not going to deal with this anymore.
And the healthcare system wasn't prepared to support them.
Not at all, right? Particularly not in a human way. Particularly not in terms of actually caring for the healthcare professionals as human beings. And so that's where the foundation came in, and we said we have to build programs, we have to apply what we've learned and make it available to our colleagues. And that worked quite well to the small degree that we were able to offer that as a small foundation. But it was one of those proof of concept studies where we saw how within hours of training, sharing, experiencing, it was possible for healthcare professionals to actually come back to balance.
Yeah.
So that was really good to see. It doesn't take like 5 years to live, in meditation like a monk somewhere, right? And you can actually, it's something that there's so much in terms of tools, in terms of insights, in terms of experience that can be shared within hours that it makes sense in real life. Tomorrow morning when I go to work at 6 a.m., 7 a.m., whenever it might be, or tonight at midnight, right? Whenever I
sleep, you actually sleep.
That was past life, right? So to actually learn how can we take care of ourselves and not forget within these demands that we want to be able to serve and address. That was followed by the war in Ukraine, and suddenly we had like 120 mothers and children here in our pediatric health center, right? And certainly that was not part of our routine healthcare, right? No. So we had to be very creative and find ways, and we were blessed that the foundation could help, and the foundation was able to gather a group of donations, a group of donor agencies and foundations, and the Swiss government and the regional government, and everybody actually saw the need and the relevance and the urgency and chimed in and helped, and it was very, very effective. So we could put together programs for children and for their mothers. So within the next 2 years, following their arrival here in Switzerland, we could actually help a great deal. And the impact was measured in a scientific way, and we could really see how it actually changes people's lives, how it creates stability, how it helps to overcome trauma, how it helps to live with trauma, and how it helps to stabilize and find balance in a foreign environment.
Yeah, sure. So many factors. But I know that you had some personal experience of these families as well, because they were living in your home with your family. So how did that influence the programs that were to come later?
It was very prototypic for how heart-based medicine works. There's an acute need. There's something real that is missing. And so we addressed this as a family, and then we saw what was needed, what these 5 wonderful beings needed, and we tried to provide that. And then we felt, well, if they need it, probably others need it too. We might just as well offer it to more, right? So this is how a lot of what we do here actually grows. It's very much need-driven and sort of real-life-driven.
Boots on the ground. Yeah. Yeah, for sure. Okay.
Yeah.
So that was the setting, if you like, for the programs that were to come. So leading on from that, what happened next?
Yeah, it was very interesting. So the host families of the Ukrainian guests in Basel, they started to call us and said, "What did she have for coffee?" Right? so they wanted to find out what is it that this heart-based center is doing. Right?
Yeah.
And at the time, it was a project, right? It wasn't a legal entity or a registered health center. It was a project of the foundation where registered, licensed physicians and psychotherapists and so were working, but it didn't yet have the structure of a health center. And so that then let us think, well, maybe what we just learned here is actually more widely applicable. Right? And it just has a different background, it has a different context, but the principles are the same. So that actually encouraged us to say, okay, let's actually make that available to the local population here, whether you're a migrant or not, right? Whether you're adult or child, why don't we just open this up and make it available? And so then actual programs for individuals emerged, and programs for companies emerged, and programs for health, for claims agencies emerged, so health insurance companies emerged. That was really encouraging.
Very rewarding. Yeah. And I know, Melanie, you were deeply involved in those projects. Can you tell us more about how they flowered from that moment on?
They flowered with a lot of fertilizer. No, it was a beautiful experience where, as Jan said, it was driven from a need-based. It was very reactive. When I arrived, I knew we were ready to transition, but we weren't sure what was going to be the nudge. And this really helped us bring the philosophy into a real-world application. And it allowed us to work with an international, intercultural service team, our service partners, our funding partners, and to create, the framework and the structure to, how do we deliver these programs? What are the locations and how do we communicate? How do we get the message to the refugee families? And that then evolved into the host families going, can I have some, please? And that really opened our eyes to, again, back to the message of this is not just for one target audience, if you will. This is not just for one group of people. This is for everybody. And it was through the work of the Meducare program that we were able to kind of look at how do we make this more sustainable? How do we make this sustainable for a bigger audience? And how do we reach it? And I know that there was so much learning from what Jan had been already doing with Yuki-Doc that then got pulled through for the adults. It was really taking a lot of different threads of what we had learned, what we had distilled through the thought leadership, and presenting it into one cohesive vision that is still evolving to this day, where we're looking at, the research proponents and really establishing this presence, pun intended, this presence on how to be more present in the moment so that we can prevent the reactive.
So it's really a time for taking from inspiration to implementation.
Absolutely.
Yeah, great.
Yeah, it was these years, I think, from 2018 to 2023, pretty much, that were sort of the foundational years and that laid the groundwork for what was then to come.
Those early years were about curiosity, connection, and thought leadership. Later, ideas turned into practice, and that's when the movement truly began to grow. Next time, we'll explore the 6 living principles and how they came alive in every act of care. Thank you for joining us for Heart of Healthcare. These conversations remind us how far this movement has come and how much heart and presence still guide the future of medicine.
What began as a reflection has grown into research, education, and real-world care through the Heart-Based Medicine Foundation. Each story, each voice is part of that unfolding.
And as this chapter closes, we invite you to stay with us as we continue exploring medicine with heart.
Together, we are learning how heart and science can heal not only medicine, but humanity itself.
To learn more or support the foundation, visit heartbasedmedicine.org.